Thank you. Senator Smith.
Thank you, Chair Crapo, and welcome, Dr. Oz, and to your family for joining us. And I want to just note thanks to my colleague, Senator Blackburn, for her focus on rural hospitals and rural health, which I is a concern that I share. Dr. Oz, I want to talk a bit about artificial intelligence in healthcare and technology. You've expanded on the many potential uses of AI and technology for delivering healthcare. And, I agree that we need to make the best use of technology to improve access to high-quality care. And in fact, I think we learned a lot from the pandemic in terms of, for example, advances in telehealth. And that is important to not forget those lessons. But so I'd like to spend my time just getting a better understanding of your thinking on the role of AI and healthcare delivery. So let's start with this. Let's start with how health insurance companies are using AI to make decision about prior authorization decisions. Could you talk a bit about that? How do you think, or do you think, that AI should be used in prior authorization decisions?
Senator Smith, I enjoyed visiting with you, and thank you for sharing some of your ideas at that time. And this is a good place to start. AI can be used for good or for evil. And it, to a large extent, depends on who's using it for what purpose. I think AI could play a vital role in accelerating pre-authorization. One reality in the healthcare system right now is the average insurance company has about 3,000 procedures that they rely on pre-authorization from, but they're not the same 3,000 procedures. So if you switch insurance companies, you may move from one that used to pre-authorize a knee replacement, the new one doesn't. So I would argue that to use AI wisely, we would make a decision, which is we're only going to pre-authorize 1,000 procedures. Everything else just should get done, because it's only 1,000 where there's a concern.
And this, I'm sorry to interrupt you, but what I think you're referring back to what you said earlier, which is that we use pre-authorizations too much. And I think I heard you say that earlier. But I want to dive in on this a little bit more, because there have been reports and lawsuits that have alleged that AI has been used by 3 of the largest Medicare Advantage insurers to determine how long patients can stay in hospitals, denying those claims, kicking people out of hospitals or even out of step-down clinics when they're not able to take care of themselves at home. And this is a big concern. I think my view is that a human needs to have a final say in these decisions that insurance companies are making. And I'm wondering if you would agree with that.
I agree with you, but if I can add just one more layer, this sounds like our conversation in your office. I think that we should be using AI in the agency to be able to tell what insurance companies are doing with their AI. The best way to detect bank fraud is not a person looking at whether a fraudster is going in to steal money, because most of us aren't thinking about fraud, so you're not very good at detecting it. So if we see that there's something being done, for example, inappropriate use of AI or inappropriate denial of services with AI, we should be using AI within the agency to identify that early enough that we can prevent it, and we should do it real time, not 6 months down the road.
Use it as a tool to address whether an insurance company is using prior authorization inappropriately.
And protect the American people. They should actually know what that AI is telling us, so they should also feel empowered to push back when they don't think it's right.
So here's another example in the time that I have. You've talked about using AI to augment care, especially in Medicaid, where we have serious shortages of mental and behavioral health care providers, I think. Dr. Oz, how should AI programs be deployed to support patients that are experiencing mental health challenges?
After I was nominated, I started spending a lot of time looking at technologies just to understand what could be the future. And after meeting with a lot of the leaders in artificial intelligence, I am seeing a lot of different demonstrations. I can attest to you that we are months away, not years away, from having AI tools that could have a conversation with someone that you care about, pick up subtle details about how they feel emotionally about a problem, whether they're going to follow through with dealing with it, do they really understand what the doctor or nurse told them. All of this is going to become part of the fabric of how we expand services. And this is not about removing doctors. I agree with your first premise that humans have to be involved, but an internist who's capable with decision support and a little bit of help from AI dealing with the intake could see twice as many patients. I'm making that number up. We don't know that for sure, depending on the severity of the illness, but see a lot more patients in order to get through the day, and that's better resources for everybody.
So here's the concern that I have with this, because I think sometimes this is not transparent to patients, and that to me is extremely important. It's been documented that there are chat bots out there that have been advertised as providing social and emotional support and even representing themselves in one case as a real licensed mental health providers when they're not. And we have documented that some of these bots have actually encouraged, in some cases, suicide or self-harm or even violence. And addressing this misuse of the technology seems to me of grave need to our society.
It's a well-identified problem. AI should worry us all, but I do believe it's a tool that, if used appropriately, and I think Congress will have to play a role in making sure we do that wisely, could help a lot of Americans and certainly will help the provider groups. But we have to be able to put guardrails around its appropriate use.
I'm out of time. Thank you, Mr. Chair.